Unveiling the pillars of power, the pharmaceutical industry's grip on humanity. The pharmaceutical industry, touted as a beacon of medical advancement, stands accused of wielding unchecked power that threatens the well-being of humanity. This investigative essay peels back the layers of influence exerted by pharmaceutical giants, revealing a tangled web of financial incentives that ensnare leaders, medical professionals, and government regulators alike. By following the money, we uncover a disturbing reality. Profit motives often eclipse the pursuit of public health, jeopardizing the safety and integrity of medical practice. The power of influence? Pharmaceutical companies hold immense sway over key decision-makers and institutions, leveraging financial resources to shape policies and practices in their favor. From lobbying efforts to campaign contributions, these corporations strategically deploy their economic clout to curry favor and secure advantageous positions within the healthcare landscape. Example: in the United States, pharmaceutical companies spend billions of dollars annually on lobbying activities aimed at influencing legislation and regulatory decisions related to drug approval, pricing, and marketing. This influence extends to both federal and state levels of government, with lawmakers often beholden to industry interests. Medical professional complicity. Physicians, revered as guardians of public health, are not immune to the pharmaceutical industry's allure. Through a combination of marketing tactics, financial incentives, and industry-sponsored education, pharmaceutical companies cultivate relationships with healthcare providers, subtly influencing prescribing behaviors and treatment protocols. Example: pharmaceutical representatives regularly visit medical practices to promote their products, offering samples, educational materials, and even financial incentives for prescribing certain drugs. Additionally, industry-funded continuing medical education (CME) programs may subtly bias healthcare providers towards favoring brand-name medications over cheaper alternatives. Regulatory capture. Government regulatory agencies tasked with safeguarding public health often find themselves ensnared in a revolving door of industry influence. Former pharmaceutical executives and lobbyists frequently transition into positions of power within regulatory bodies, blurring the lines between oversight and industry advocacy. Example: the Food and Drug Administration (FDA), responsible for evaluating and approving new drugs, has faced criticism for its cozy relationship with the pharmaceutical industry. Instances of regulatory capture, where FDA officials have financial ties to the companies they regulate, raise concerns about conflicts of interest and compromised decision-making. Follow the money. At the heart of the pharmaceutical industry's stranglehold on humanity lies a simple axiom: follow the money. Profit motives permeate every facet of the industry, driving decisions that prioritize shareholder returns over patient well-being. From exorbitant drug pricing to aggressive marketing tactics, the pursuit of profit often eclipses ethical considerations and public health imperatives. Example: the infamous case of Martin Shkreli, former CEO of Turing Pharmaceuticals, epitomizes the industry's profit-driven ethos. Shkreli garnered widespread condemnation for hiking the price of a life-saving drug, Daraprim, by over 5,000%, demonstrating the industry's willingness to prioritize profits at the expense of patient access to essential medications. The human cost. While pharmaceutical companies reap record profits, the human cost of their actions cannot be ignored. Skyrocketing drug prices, widespread overprescribing, and the suppression of affordable alternatives contribute to healthcare inequities and undermine public trust in medical institutions. Ultimately, the unchecked power of the pharmaceutical industry poses a grave threat to humanity's collective well-being. Example: the opioid crisis, fueled in part by aggressive marketing and overprescribing of prescription painkillers by pharmaceutical companies, has claimed hundreds of thousands of lives in the United States alone. The human toll of addiction, overdose, and shattered communities serves as a stark reminder of the consequences of unchecked industry influence. Conclusion. In conclusion, the pharmaceutical industry's stranglehold on humanity is a sobering indictment of unchecked corporate power. By following the money, we uncover a web of influence that extends from the halls of government to the offices of healthcare providers, shaping policies and practices in ways that prioritize profit over public health. To safeguard the well-being of humanity, it is imperative to challenge the pharmaceutical industry's grip on power, demand greater transparency and accountability, and prioritize ethical considerations in medical practice and policymaking. Only then can we hope to reclaim control over our health and protect future generations from the pernicious influence of profit-driven pharmaceutical interests.